Hello, my name is Dr. Dewan S. Raja. Today I will discuss about infratemporal fossa. The infratemporal fossa is an irregularly shaped fossa located below and medial to the zygomatic arch. It communicates with the pterygopalatine fossa via the pterygomaxillary fissure. So this is the infratemporal fossa, and it is bounded anteriorly by the infratemporal surface of the maxilla. Here it is bounded laterally by the ramus of the mandible, medially by the lateral pterygoid plate. Above it is bounded by the greater wing of the sphenoid bone, okay, and posteriorly bounded by the styloid process of the temporal bone, and the condylar process of the mandible should be here, okay. So this is the boundary of the infratemporal fossa. Its floor, there is no bony floor, but we'll get the medial pterygoid muscle in the floor area. So we got the infratemporal fossa and its boundary. Let's go there. So here again, boundaries above greater wing of the sphenoid bone, laterally medial surface of the ramus of the mandible, medially by the lateral pterygoid plate of the sphenoid bone and pyramidal process of the palatine bone, anteriorly posterior surface of the maxilla, posteriorly styloid process of temporal bone, and condylar process of the mandible. Okay, so we got the boundary. Contents will get the nerve. Nerve is the most important nerve, is the mandibular nerve. Okay, mandibular nerve, and also will get the posterior superior alveolar nerve, and we'll get some branches of the facial nerve and the otic ganglion, the lesser petrosal nerve. We'll get nerve vessel, we'll get the maxillary artery and its branches. Vein, we'll get pterygoid plexus of vein here. So we have artery, vein, nerve, muscles. Artery is the maxillary artery, and nerve is the mandibular nerve. Also, we'll get the chordae tympani branch of the facial nerve. We'll also get the lesser petrosal nerve, otic ganglion, and vein will get the pterygoid plexus of vein. Okay, here we are seeing structure more distinctly. This is the maxillary artery. This is the terminal branch of the external carotid artery. This is the maxillary artery. Okay, we got that. Then we'll get the mandibular nerve, and close to it we'll get the otic ganglion, not distinct here, it's small maybe on the other side. Okay, and we'll get the vessels like posterior superior alveolar artery. These are branches of the maxillary artery that will supply the upper jaw teeth area. And we got the nerves here, the branches of the mandibular nerve. Here we're getting inferior alveolar nerve, and this is the lingual nerve here. So nerves, mandibular division of trigeminal nerve and its branches, posterior superior alveolar nerve, chordae tympani nerve. Posterior superior alveolar nerve is also a branch of the maxillary nerve. Chordae tympani nerve, branch of the facial nerve. Otic ganglion. There is a parasympathetic ganglion, mostly innervate postganglionic fiber to the parotid gland, lesser pectoral nerve that carry parasympathetic fiber to the otic ganglion, arteries, maxillary artery and its branches, vein, pterygoid plexus of vein and its tributaries, muscles, medial pterygoid and lateral pterygoid muscles. Okay, so we got the contents of the infratemporal fossa. And that's all about the boundary and contents of the infratemporal fossa. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.